Hello, may I have your name, please? Are you the patient being admitted today for surgery tomorrow? Before we go in, I'll just check your temperature real quick. Let me take your temperature now. Your temperature looks fine. Shall we head this way? I'll show you to your room. Please sanitize your hands before going in. You'll be using this bed. We've placed your hospital gown here. Please change when you're ready. There are a few consent forms we'll need you to fill out here in the ward. I'll come by shortly to collect those. Also, since you're scheduled for surgery, we'll need to run a quick antibiotic sensitivity test. After you change, please wait here for a little while. You can have dinner as usual tonight, but please remember that from midnight you'll need to fast. No food or drinks. Between 8 and 9 p.m., you'll receive an injection as part of your pre-op preparation. If you find that you need any supplies, please check with us before purchasing anything yourself. We'll help guide you to what's most suitable and comfortable. If you have any questions at all, don't hesitate to ask. We're always here to help. Let me give you a brief orientation of the ward. This is the restroom for patients only. We kindly ask caregivers to use the shared bathroom near the nurse's station. There are separate shower rooms for men and women. Caregivers and guardians may use them as well. In this pantry area, you'll find a water dispenser and microwave. If you finish meals late, you can place your tray in the designated area above. We insert the IV the day before the operation. All right, it's time to head to the operating room. We'll walk together to the nurse's station first. Have you removed your undergarments? Great. You fasted properly and all jewelry and accessories have been taken off, correct? Will you be all right without using the restroom one last time? Please lay down here. Rest your head at this end and gently raise the leg you'll be operated on. I'll confirm the surgical site marking. You're scheduled for tibia surgery today, correct? Okay, we've confirmed the mark on your calf. Before heading into the OR, we'll give you 1 dose of the antibiotic we tested last night. Once the surgery's over, you won't feel completely pain-free. When you wake up, there will be pain. It's unavoidable. It's likely going to hurt quite a bit, but don't worry. Our anesthesiologist and Dr. Lee will give the optimal amount of pain relief medication. If you're in a lot of discomfort, just let us know. We'll take care of you. Everything is confirmed, surgical sites marked, IV line is in place, fasting and jewelry removal have all been verified.
We're ready to proceed with the transfer. Patient is here. Could you lift your head slightly for me?
Hello, may I confirm your name, please? You're here for your first tibia surgery, is that right? Do you have any pre-existing conditions or allergies? Have you ever gotten general anesthesia before? Do you have any loose teeth? I'll briefly explain the general anesthesia. Please write your name and sign here.
Slowly move over to this bed.
We're going to secure your arms and legs now.
You'll start to feel sleepy as soon as we begin administering the medication. Take a deep breath in, it might sting a little. The surgery's all done now. Focus on taking deep breaths. Inhale deeply and exhale. That's perfect, keep breathing just like that. You cannot fall asleep. We'll be moving you back to your room in about 10 minutes. Until then, please stay awake and continue deep breathing.
Keep taking deep, steady breaths. For the next hour, try not to fall asleep and focus on deep breathing. Do you remember the lung exercise tool we gave you yesterday? Please use it once every 6 minutes, 10 times per hour, for about the next 80 minutes. Deep breathing will help with your recovery. Great job!